When patients present with co-occurring uses, like co-occurring THC use and heavy social media or gaming or
hmm
binge eating, any of those things, how do you decide whether to treat this as several separate problems or just one integrated transdiagnostic reward system issue?
So I think this goes back to the point about the biopsychosocial element, where biologically I may treat it separately. If, let's say, somebody uses alcohol and somebody uses opioids, that I can use theoretically I can use naltrexone to treat both, but I may be more inclined to use, let's say, methadone to treat the opioids and a camprosate to help them with their alcohol use. So biologically, you may be able to parse it out depending on the cravings. You want to obviously mitigate any withdrawal symptoms, cravings, those things. But psychologically, from a therapeutic standpoint, you can ideally address it as a similar core issue. What is it that this person is trying to gain or cope with that they're using the alcohol for or the opioids for? And then again, similarly, socially, it's all one person. So, what does their finances look like? Or do they have secure housing? Do they have a strong support network and things like that that we can provide them resources to fill those gaps? Because usually, when we're thinking about individuals who are using various substances or have addictions, there's typically some element of avoidance that's underlying this. It's not always, but generally speaking, you talk to people, they're trying to numb pain, they're trying to take a relax or take a break from their life, and there's this element of distancing themselves from the experience that they're having in the world. And so from a psychological component, you can kind of parse all of that to one thing, but biologically you may use different agents to address them. So that's kind of, again, the step that we're taking from a biopsychosocial respect to make sure that all those elements are being addressed appropriately.
hmm Practically, what are high yield questions or brief assessment tools you recommend to capture digital behavioral addictions in a standard psychiatric intake without adding, say, 20 minutes to the visit?
I think the one thing is really just asking about it. Because generally, if you were to go to somebody, come to me for an outpatient addiction, consultation evaluation, I'm going to ask you about opioids. I'm going to ask you about alcohol, benzodiazepines, cannabis, like the classic drugs, cocaine, methamphetamines, etc., that are asked about. But traditionally, at this point, people are not asking about your social media experience or your internet usage. They're not really asking as much. They are, I would say, now kind of entering a space of gambling, sex, and pornographic addictions. Those things are kind of beginning to expand, but I would say definitely at a slower and at a lesser rate. So I think even just opening that door is more than the average person would be able to or be able to experience. And then if you take it a step beyond that, if we're talking about phones and social media, again, going through the actual phone and going to, how much screen time do you have? What is your, whether it's Instagram, TikTok, like, what does that time look like? And ask them, when you're using this, is this just, do you use this during work? Is this affecting your relationships and interactions? And I think just those quick questions can actually lead to a lot.